Have you ever noticed your child suddenly changing their eating patterns, perhaps becoming incredibly picky or losing interest in food altogether? It is natural for kids to have fluctuating appetites, but sometimes these changes can signal something deeper, something that might need extra attention. Significant, persistent shifts in a child's eating habits often mean it is time to seek professional help, especially if these changes impact their health, daily functioning, or emotional well-being. This includes extreme pickiness, a sudden strong aversion to many foods, rapid weight loss or gain, or secretive eating behaviors. These changes can be red flags because they are frequently linked to underlying emotional or psychological factors. For example, a child experiencing anxiety might lose their appetite, while one struggling with control issues might fixate on food intake. Eating habits are deeply tied to emotional regulation, stress responses, and self-perception, especially during formative years. When a child's relationship with food becomes distorted, it can indicate that their internal world is experiencing significant distress, which they might not yet be able to verbalize. To decide if professional help is needed, start by observing the duration and severity of the changes. Is it a temporary phase, or has it lasted for weeks or months? Also, consider associated symptoms like increased irritability, withdrawal from friends, obsessive thoughts about food, or body image concerns. Talking to your child openly and gently about what they are experiencing can provide valuable insight. If these observations point to a pattern that worries you, or if your child's physical health is declining, consult with their pediatrician first. The pediatrician can rule out medical causes and then refer you to a child therapist, a registered dietitian specializing in pediatric eating issues, or a mental health professional. Early intervention in these situations is incredibly important because childhood eating issues can escalate quickly and become more entrenched over time. Professionals can help identify the root cause, whether it is anxiety, depression, body image concerns, or a developing eating disorder, providing targeted strategies and support. They offer a safe space for your child to explore their feelings and learn healthier coping mechanisms, which empowers them to build a positive relationship with food and their body for the long term. This specialized support can make all the difference in preventing minor concerns from becoming major struggles. Ultimately, trusting your parental instincts and acting on them promptly is key. When you see significant or concerning deviations in your child's eating, understanding that these can be calls for help allows you to respond with informed compassion and seek the right professional guidance. This proactive step helps safeguard their physical health and emotional development, setting them on a path toward greater well-being and resilience.